So therefore, we are very, very pleased to have our colleagues from Australia. Professor Jo Robinson is at Orygen. She's an international pioneer in the research on the impact of social media and self-harm. And she has also been very influential by her development of the chatsafe preventive approach. And a couple of years ago, our center was invited to cooperate with the implementation of chatsafe in Norway. We are very, very glad for that opportunity, and we continue the work. And in the implementation process, we have had great help from the group Sykt Ærlig, who we're going to hear more from later on. But first of all, I'd like to welcome Jo and Louise. Please come up. As I said, Jo is a professor, and Jo is a postdoc at Orygen, who is very much experienced in and interested in self-harm, social media, and also in the schools. So we're going to hear more about that a little bit later. So please.
Tusen tack. Thank you. It's lovely to be here. Thanks, everybody, and thank you for being such lovely hosts and being so welcoming to us. We're really thrilled to be here, back in Norway again after a few years. So I'm going to talk a little bit today about some of our work that we've been doing in Australia over the last little while. I'll give you a bit of a broad overview around what's happening when it comes to suicide and self-harm in Australia. I'll talk a little bit about some of our work in schools and around youth participation in suicide prevention. And then I'm going to hand over to Louise, who'll talk a little bit about our work in social media. So let me just see. Yep, so this is where we're based. We're based in Australia. We're down here in Melbourne. We're part of the University of Melbourne. So Orygen we're a big organisation. We offer clinical services to young people aged 12 to 25 from our catchment area in the north and west of Melbourne. But we also are part of the University of Melbourne. So I lead the Youth Suicide Prevention Research Group there. As you can see, Australia is a really big country, and this is what happens if you pop Norway on top of Australia. So a beautiful country, Norway, but much smaller than we are in Australia. And so Australia is big and it's very diverse. So there's a lot of diversity in terms of what you see geographically, but also socioeconomically, and in terms of suicide and self-harm rates when you compare our capital cities like Sydney and Melbourne and Adelaide to some of the parts of the more remote and regional parts of Australia, particularly here in the middle, where you're quite a long way from anywhere. We were lucky enough to get some funding to have a beautiful brand new building a few years ago from the state and federal government. And you can see our building here, although we have spent the most of the time since the building was built working from home on Zoom, which is a bit disappointing. I'm going to present a little bit about what's happening in terms of suicide and self-harm in young people in Australia. And I think just before I do that, what I am going to present are some data in terms of kind of showing you things like graphs and some numbers and percentages. But just as a reminder, we're always very mindful when we're presenting information like this, that behind every single one of these numbers was a distressed and frightened young person who'd lost hope for their future. And beside each of those young people, of course, are families and friends who have been left behind. So I'm always just very mindful of that when presenting numbers and percentages. But that said, what you can see from the slide and from the graphs is suicide rates in young people are increasing in Australia. And rates of self-harm are also increasing, and I'll show you some of that in a second. We know that there's been lots of research that's being done through the pandemic to look at what's happened to suicide rates during the course of the pandemic. And a lot of the data from many countries actually don't show an increase. For the most part, it doesn't look like suicide rates have gone up across the population yet in most parts of the world. But that's not the case for young people. So although rates appear to be stable in the adult population, rates do seem to be going up in young people. Again, what you can see from the slide is rates are higher in Australia in males, but they're really increasing in young females. And I think, the lines are a bit hard to see here, but you can see That's all. Actually, you can't see the female line. It's down here, but it's increasing at quite a significant rate. So rates are also much higher in First Nation Australians, so Aboriginal and Torres Strait Islander young people, in queer young people, although we're not doing a very good job of collecting robust data. So I think we probably need to do a better job of getting a really reliable picture of what's happening there. And in our rural and regional areas, which are a long way from our capital cities and probably quite underserved when it comes to mental health services or access to care. The other just couple of things that I wanted to say is that youth suicides are more than twice as likely to occur as part of a suicide cluster than adult suicides. And around 7% of youth suicides in Australia have been exposed to a previous suicide attempt or suicide. And so we know that those young people that have been exposed to a suicide are at significantly increased risk of feeling suicidal themselves in the future. And this has become important when we've started to think about our chatsafe and social media work that Louise will talk about shortly, and how we might use social media to try and reduce the risk of suicide clusters occurring. So this just gives you a bit of an idea of what's happening when it comes to self-harm and suicide attempts. So again, what you can see, these are data that have been collected across Australia from the longitudinal study. And 14 to 15-year-olds, so nearly 10% of 14 or 15-year-olds have reported engaging in self-harm. And at 16 to 17 years, that's gone up to about 11%, or just over 11%. And again, you can see here that those rates are significantly higher in young females than young males. And a significant proportion of those who've engaged in repeated self-harm go on to make a suicide attempt or die by suicide. And I always like to point this out because I don't know what it's like here in Norway, but certainly in Australia, when young people, and particularly young females, present for help with self-harm, they often get turned away from care, from services. They're often told they're attention-seeking, and they're very stigmatized, and they don't get the help that they need. But actually what we're seeing now are these young females, actually their behavior getting more severe, more worrying, and it's actually starting to show in the suicide statistics. This just gives you another idea. We did a lot of advocacy a few years ago to get a national, a really good, reliable surveillance system or monitoring system of suicides and suicide attempts in Australia. And it's been set up by the Australian Institute for Health and Welfare. And this gives you an idea of some of the data that they collect and show. And what I'm showing you here is self-harm data or self-injury data over the period from March 2018 until where are we? September 2021. And here again, what you can see are these significant increases, particularly in young females over that period of time. Now, I'm showing you data here for self-injury, but it would have been exactly the same pattern if I'd showed you suicide attempt or suicidal ideation or hospitalizations. So we're really seeing this quite concerning pattern in terms of increases in self-harm presentations amongst young females. And the other thing to bear in mind is these are people that are seeking help. This is probably the tip of the iceberg in terms of the actual prevalence of this as a problem. So I'm going to give you a short snapshot of our work. And I'm particularly going to focus on a little bit of work that we've done around school settings, some of the work that we're doing around youth participation, and then I'll hand over to Louise to talk a little bit about our social media work. So this is a big piece of work that we did now a few years ago. It was a big systematic review and meta-analysis. And what we were interested to know here is what works in youth suicide prevention. And we were interested in looking at what works in clinical settings, what works in community settings, which is invisible. I put that in invisible ink. And then what works in education or workplace settings. And again, what I wanted to draw your attention to here is the school-based settings, where you can see that the studies, we found 31 studies, 15 of them were randomized control trials. And what we found here was that these large studies were able to reduce self-harm following the intervention and follow-up. And also they were able to reduce suicidal ideation following the intervention. There was also some evidence that came out of the clinical studies. These were the ones done in clinical settings that also showed positive results. And the community-based studies did as well. But again, as I said, I was going to focus mostly on our education-based studies. And really the interventions that appeared to be driving these results, or most effective, were large-scale school-based psychoeducation interventions, so educational workshops delivered to the whole school population, regardless of trying to work out who's at risk or who isn't, and then combined with a screening or case detection type component where you're actually trying to identify who in that sample of young people might be at risk of suicide or self-harm. The other thing that I just wanted to draw your attention to were some of the gaps that we identified when we did that big systematic review. So we were really looking at all of the studies we could find around youth suicide prevention, and as you can see, we found 99 of them. There were significant gaps in a whole range of settings. So as you can see, there were no studies around primary care, very few in higher education or workplace settings. There were lots that were done in schools, very few studies online, which, thinking about what we're here to talk a little bit about, social media, that seemed to be a big gap for us. Very few studies in those vulnerable populations that I mentioned before, so Aboriginal Torres Strait Islander young people, or First Nations young people, queer young people. But the other thing I wanted to draw your attention to is this, that very few studies were designed by or for young people. So a lot of the studies that we found in here, these 99 studies, most of them were testing interventions designed for adults and just really trialing them on young people. So it was kind of probably not a surprise that we're not necessarily seeing the results that we might want to see if studies aren't really being designed by or for young people. So a lot of those studies were, as I say, driven by some really big studies that tested education-based workshops and combined them with kind of case detection or screening kind of interventions. And a couple of the biggest ones are showcased here. There's the big SAILI trial that people may have heard of that was conducted across Europe some years ago. And then there was another one that was conducted in the United States that was evaluating the sources of strength intervention. So really, what's possibly interesting about these studies is that for a long time, suicide prevention interventions weren't really being delivered in school settings like this because people were afraid of doing harm. They were afraid that by talking to classrooms or rooms full of students about suicide, that they might inadvertently put ideas into people's heads or increase risk or distress. So there weren't very many of these studies being done, but you can see from these big studies, they can be positive, they can have a really positive effect. So what we set about doing was starting our own body of work around all of this. And I'm just, again, highlighting some pilot studies we've done here, where we tested a universal education program. So we tested the Safe Talk program. I don't know if people have heard of Assist and Living Works. They've got a suite of educational programs, and we tested the Safe Talk program in high schools in a place called Alice Springs in Australia, which is the city right in the centre of Australia, so right in the middle of the desert. They don't get a lot of access to mental health services or research. So we tested that, and we found that not only was it safe to do that sort of work with young people liked it, they found it beneficial, and it appeared to increase their likelihood of seeking help. It appeared to increase their confidence when talking about suicide with their friends. We also were thinking about those big gaps in online intervention. So we know that young people often turn to the internet to receive help or to seek information. So the other thing we did a few years ago was design a cognitive behavioural therapy program that was designed to be delivered online by school counsellors in school settings. So we designed this. It was kind of an 8 modules worth of, it was video diaries. So we call it CBT Lite. It was based on cognitive behavioural therapy, but it was very easily delivered by video diaries with young people. And we tested those in a couple of sort of progressively more rigorous studies, I suppose. And again, we found that it was safe and acceptable, and it appeared to reduce suicidal ideation and hopelessness and depressive symptoms in high school students. The other study that's gone missing from here was testing an educational workshop with parents, because that's the other thing that is often done. We often use what we call gatekeeper training, I suppose, to build the capacity or train up people that surround young people in their ability to identify risk or support young people better. And we often do that in education settings with school teachers or school counsellors. But of course, the other really important adults in a young person's life are their parents. So we also did a study testing that with parents, with positive effects. Oh, there it is. And what all of that led to is a big, multifaceted programme of work that we're now delivering in schools across the north and west of Melbourne. So I've set this up as a framework for suicide prevention in schools. So people might be familiar with this kind of public health approach to mental health prevention and treatment that we use in suicide prevention as well. So again, you start at the bottom with these universal or general population interventions. And here we're trialling that Safe Talk program with a population of about 4,000 school students in the north and west of Melbourne. We're only at the start of this project, and we've got just over 600 so far recruited in. The pandemic slowed us down a bit. But we're testing that. And by testing it and evaluating its efficacy and its safety, we're also able to identify any young people who might be at risk of suicide. And those young people then get randomized to receive the online intervention that I showed you in the previous slide. So that will be tested in about 200 at-risk school students over the next couple of years. We're also offering assist, so that's 2 days worth of gatekeeper training to school staff and a short online version of the training to parents. And we'll be able to evaluate the whole of that delivered collectively. So that's a big piece of work that we're doing in schools. The other thing that I was going to just talk briefly about is youth participation in suicide prevention. So as you saw from the big meta-analysis study that we did, young people are very rarely actively involved in suicide prevention activities. Again, I don't know what it's like here in Norway, but certainly in Australia, we've gone a long way towards involving people with lived experience in the suicide prevention work that we do and in the co-design and development of mental health services. But we haven't done such a good job when it comes to young people and suicide prevention. And that's despite the fact that there are lots of potential benefits of co-designing and doing co-participation work with young people. So you can see here, there are lots of benefits to the young people to be involved as peer researchers, and including some of those benefits of feeling heard, having their experiences validated. Often young people tell us when they take part in research that actually we're the first people that have really shown an interest and listened to them discuss their problems and what's going on for them. They do find it empowering, they enjoy being able to help others, and they develop skills. But of course, as researchers, we also get much better research and much more youth-friendly interventions if we're designing them with the people that we're trying to help. But again, historically, the sector's been worried about involving young people in suicide or self-harm research for fear of doing harm. This is just a screen grab from the meta-analysis that we showed, that I showed you before. And based on that, we then did a survey of all of the authors whose studies appeared in our big systematic review and asked them if they involved young people in their work and what the challenges or benefits were. And basically, we call this a failed investigator study because hardly anybody replied to our survey. And we took that as an indication that this area of work wasn't actually very important to most academics, even though we think it's really important to be involving young people in the work that we do. So we're doing a piece of work at the moment, which is developing a best practice framework or set of guidelines to help or to guide youth partnerships in suicide prevention research. So we're doing what we call, or what's called, a Delphi expert consensus study. So we research all the, we look at all the literature or other guidelines or frameworks that exist. We pull out all of the action items or things that we think should be in a set of guidelines, and we send them to 2 panels of experts, young people and suicide prevention researchers. And anything that gets over 80% worth of consensus across those 2 panels, all of the items, then get included in a set of guidelines that we hope will help researchers partner up or feel more confident and more able to partner up safely with young people doing suicide prevention research in the future. We also hope there'll be some resources in there for young people to help them know what to expect when they do take part in suicide prevention research, how to advocate for themselves, for their own safety. And we're hoping it will be helpful for ethics committees to give them more confidence in the fact that it is safe and acceptable to include young people in suicide research. And ultimately, what we're hoping is for better suicide prevention interventions and better outcomes for young people. So that's just a little bit around what we're doing in youth participation in research. We also do a lot of work around youth advocacy and actually really having young people involved in the advocacy work we do when we talk to policymakers or service providers. And that's really about having young people's voices front and center as we're kind of developing policy, listening to the needs and wants of young people so that when we are designing suicide prevention strategies or interventions, they're actually based around what young people want. So again, this is just an image from a webinar that we did a little while ago with a group of young people that was extremely well received and really actually generated a lot of hope. It was very positive, and young people had all sorts of ideas around the ways that we could be better supporting them than any of the ideas that us older people might have come up with. And we also, as we did this, we co-authored a blog together that got published in this American-based kind of mental health publication. So probably one of the best examples of youth participation in our work is the chatsafe project, which is all about our work with social media. And I'm going to hand over to Louise, who'll talk about that. And then I will be back at the end to wrap up.
Thank you.
Thank you.
Hello, everyone. Thank you for having us all the way in Norway. So like Jo said, I'm here to talk to you about the chatsafe project. And the chatsafe project really came about because there was a lot of concern that as rates of suicide were rising, so were rates of social media use. And so there were a lot of people drawing parallels between increased use of social media and these increased rates of suicide and self-harm that we were seeing among young people. And there's a whole lot of reasons for why people are concerned about social media. One of those being that obviously information can spread very quickly and very fast. So geographical boundaries are no longer keeping information contained, it's spreading across the world and it's spreading across multiple platforms very quickly. We also know that young people are spending a lot of time on social media. So I don't know what the rates are here in Norway, but we know that in Australia, young people are spending around 3 to 5 hours a day on social media alone. So that's not online activities related to their schoolwork or anything else, that's just socialising in the online space. And we know, from the research on the traditional media, from the traditional media literature, that there are fears that certain types of content can lead to contagion or can lead to imitative behaviour. And so obviously if information is spreading very quickly and very widely online, it's very unregulated, and obviously young people could come across quite distressing or quite upsetting information. And so that does make people very concerned. We were aware that young people were using social media to talk about suicide and self-harm, and they were doing that in a whole range of different ways. So firstly, we know that some young people turn to social media to talk about their own suicidal feelings and experiences, or they might come across information on social media about a friend or something that they see online that makes them worried about their peers. We know that when a suicide occurs, particularly if it's a celebrity or a public figure, a lot of information around that death circulates on social media. And we know that sometimes people come across this information by accident or not without intending to. So you might be scrolling on your phone and then all of a sudden see something on social media. And so again, sometimes people are coming across this information without necessarily being aware that what they were about to see could be quite confronting. There's also a body of work that's looking at, again, drawing parallels, primarily correlations between time spent online and other things such as cyber victimisation, suicidal ideation, and increased self-harm. However, we can ask young people not to talk about suicide and self-harm, and that's absolutely not what they're going to do. So we were big believers in trying to come up with ways where social media could be part of the solution and not just be viewed as part of the problem. So that led to the creation of the chatsafe guidelines and the chatsafe intervention. So in 2018, Jo and the team created the chatsafe guidelines through a Delphi consensus method, so through the study, a similar study to the one that she just mentioned before. And that brought together media professionals, suicide prevention experts and young people to rate a series of items around what would keep them safe when communicating online about suicide. So the guidelines were very much intended around, if you're going to have these conversations, if you come across this information, how could you keep yourself and your mates safe? Now, the guidelines were, like I said, created in 2018, and they sat on the Orygen website, and we're very aware that that's not necessarily a friendly way to deliver information to young people. So we then set out across Australia, and we ran a whole series of co-design workshops, asking young people to help us bring the guidelines to life. And so we asked them to turn the guidelines into bite-sized chunks of content that we could then share in a social media campaign. And so the social media campaign that you will see, if you have checked out the chatsafe social media pages, or if you haven't, please do, all of that content has been co-designed by young people, and they've helped us turn it into a youth-friendly social media campaign. I might just say that the campaign up until now has reached over 4 million young people around the world. In the first 12 weeks that we ran it in Australia, we managed to reach 1.5 million young people, and we primarily reached them via Instagram and Snapchat, because that's where young people were at the time, but we were also on Facebook and YouTube and Tumblr and Twitter. Now, since the creation of the guidelines and the social media campaign, we have also created a whole suite of other resources. And the reason for that was because I think we were doing quite a good job at upskilling and increasing the confidence of young people to communicate safely online about suicide, but teachers and educators and other community members weren't quite as equipped and weren't quite as confident to do that. So the first guide that we created was a guide for communities, and that was really around how can communities respond if a suicide occurs, what information could they push out via social media to keep their people safe. The next one we created was chatsafe for educators. That's really designed so that school teachers and other educators within a school system can really support their students to stay safe online and know what to do if they overhear their students talking about what they've seen on social media. Often we know teachers don't necessarily feel that talking to young people about their social media behaviour is their place. And the last resource that we've most recently created is called chatsafe for parents and carers. And like Jo said before, that's so that we can also provide that support to parents in a young person's life, so that if they do go home from school or they do see something online and they want to have these conversations, that their parents can model and encourage safe communication. We then received some support from Meta, so Facebook at the time, to globalise the chatsafe resources. And so the youth guidelines could then at that point be found in 11 different regions worldwide. In many different translations. We've lost count now. And we've recently just globalised the educators resource as well, so it's also available in a bunch of different languages. And we're just about to globalise the parents and carers resource. In globalising the resource, we also globalise the campaign, and so different parts of the world also have different social media bits of content or tiles. And I thought I would just let you know that all of these resources are available in Norwegian. So we do have the supports for young people in Norway, both for the young people. I think that says parents, and I'm hoping that says educators. Parents and carers, and that says educators. I don't speak Norwegian, sorry. We've also got chatsafe in Norway, and there's a chatsafe in Norway page on Instagram, which I would encourage you to follow. You might hear a little bit more about that in a bit, but they've done a fantastic job at updating the chatsafe content. And there's the Instagram page if you wanted to follow it. Now, we are researchers and we don't have time to go into the research, but I do just want you to know that we have evaluated the social media campaign in terms of its safety and its acceptability, but also does it actually help young people communicate more safely? Does it make them feel more confident? I suppose the quick answer to that is yes. It is safe, it was feasible, and it does make them feel better equipped to have conversations online about suicide in a safe way. We were able to see some increases in some young people's willingness to intervene against suicide. They were more likely to reach out to someone if they were worried about them and have that conversation safely. They were less likely to share information about suicide on social media, so it's not something we set out to do, but it probably made them stop and think a little bit about what they were posting. And overall, the findings from, we've done 2 studies. We did a universal study with young people from Australia. We also reran that study with young people who had been bereaved by a suicide, and so they were a slight more vulnerable sample. And again, the findings were in parallel or mirrored the findings from the universal sample. And overall, young people really seemed to think that this was a good way to be reached with suicide prevention information. Because of that, we are now using chatsafe or posting chatsafe in real time as a post-vention response when a suicide occurs. So we've partnered up with the Department of Health in Victoria, but also in many other jurisdictions of Australia and also New Zealand. And they notify us when a suicide of a young person occurs, and we push out chatsafe content in real time to support those communities. And we do that by reaching young people with the chatsafe content, but by also letting community members and educators and parents know that these resources are here and they're here to help you in this moment. It doesn't say it here, but the post-vention response that chatsafe has pushed out has now just reached 1 million people across Australia. So we are able to reach lots of people in a relatively short space of time with information that we hope is super helpful to them. So what's next? It's a huge body of work. We are in the process of updating the chatsafe guidelines, so chatsafe 2.0 will be ready very soon. And the next iteration of the guidelines will include information about self-harm, so it won't be specific to suicide. It'll also include information about other types of social media behaviour that didn't necessarily exist when the initial chatsafe guidelines were created. We are translating our resources, and we're hoping to run 2 international studies, one here in Norway with partners in Norway and one also in the US. We are running some large trials, so we're just about to start an RCT of the universal intervention in Australia. That's due to start next month. As Jo mentioned, we're also trying to consider school-aged young people, so what do younger adolescents require, how are they interacting online? And so that's a body of work that we're about to start in schools. And we're also creating some guidance or some white papers for policymakers and the social media industry. I didn't mention it there, but we do a lot of work partnering with Meta and TikTok and Snapchat and listening to them about what they see the challenges to be. And so we hope to provide some information to them about what young people and parents and carers and the policymakers think is required. So that is a very quick, I hope, introduction to chatsafe, but please do let us know if you have any questions, and I will pass to Jo to finish us off. Thank you.
Thanks, Lou. So one of the, I'll just go back 1 second. So one of the things that really has struck us, not only in terms of the research gaps, around online, testing interventions that are being delivered online for suicide prevention, but also in policy, is the potential role of social media or online interventions or technology generally for suicide prevention strategies and policy. So, over the years, I've been very involved with policymakers across Australia, elsewhere in the world as well. And when it comes to communication, there's always a section in the guidelines around safe media reporting of suicide, but there's never any consideration of the role of social media in suicide prevention, including the opportunity for social media to be used as a suicide prevention strategy. So that's kind of part of what drove this piece of work here. We really want to start talking to government about how they could include social media as part of a suicide prevention response in future. So we do, as I say, at Orygen, do a lot of advocacy work, and we do work with policymakers. And Australia's a complicated country with about 8 jurisdictions, which means we've got a federal government and then we've got 8 state or territory-based governments. And many of those governments are currently in the process of updating their suicide prevention policies or plans. So we've just started doing a piece of work that's really advocacy focused. We've developed a paper around, or a brief for policymakers at the moment, that's really saying if we're going to make a difference, you've seen all the data, suicide rates are going up, rates of self-harm are going up. If you really want a difference, we actually need to be doing things differently. So we need a youth suicide prevention strategy or implementation plan that really is co-developed with young people and speaks to the ways young people interact with each other, interact with the healthcare system. We also need this to be a cross-government approach. I don't know how Norway's fared coming out of the pandemic. I like to think we're coming out of it. But I think in Australia, there's a lot of people are recognizing that we can't talk about suicide prevention if we're not talking about access to an income, if people haven't got enough money to have a roof over their heads, if people are affected by, the impact of climate, we're either on fire or underwater in Australia these days. We really need a cross-government approach if we're going to do suicide prevention properly. Young people, I would argue, have really been disproportionately impacted by the pandemic because of their phase of life. So we really need a proportional response when it comes to suicide prevention. We're also calling for ongoing data surveillance and data collection, a joined-up healthcare system, and that we really do capitalise on the benefits of technology and social media, and that we're really, first and foremost, suggesting that young people are front and centre of that strategy. So just in summary, rates of suicide and self-harm are increasing in Australia, but evidence does suggest that there are a number of interventions that can be effective in reducing risk. So we shouldn't lose hope, but those interventions do need to be delivered across settings, including in schools and online. And it can be safe and beneficial to include young people in suicide prevention research. So as I said, we're really advocating for future suicide prevention strategies to better reflect the needs of young people. And I will leave it there. Thank you all again for the invitation.